we need to accept that we actually don't know much about this strain. Time will show us how bad it is.
Do you get the impression that we have been quicker to deal with this particular Ebola outbreak than we were 10 years ago, more than 10 years ago, I should say?
We're dealing with a different variant, right? And even looking at the outbreak of this specific variant, the first outbreak in 2007 to 2008, it was on record 149 cases and at least 37 people killed. That was between 2007 and 2008. We're now dealing with more than double that in a much shorter period of time. We need to accept that we actually don't know much about this strain. Time will show us how bad it is.
How concerned do we genuinely have to be in this part of the world about what is taking place in DRC, in Uganda, and presumably, potentially, other parts of Africa very, very soon?
As an individual, you don't need to be worried at all, I would say, because if you're not going to have any contact with anyone from that region, any infected patients, the risk to you is almost zero. But on another level, you, as a global citizen, you should be very concerned about international outbreaks of deadly diseases, because as an international citizen, we know...
As a human being.
As a human, exactly that, all right? Because we know now, because of the lessons learned from 2020, the world is a connected, interconnected place. Nobody would have worried right now about a fish market in Wuhan had we not had the pandemic. We need to make sure that the global health systems all support and work together. And when we have an outbreak like this in Central Africa, that the international community can mobilize and support, because ultimately, if you have failing health systems who aren't supported, then it comes back and it comes back hard to impact all of us around the world.